about to drive your car out of New Orleans, you go to Houston, to Jiffy Lube, they can tell you when you change your oil, when you change your windshield wipers, when you change your tire. They can tell you anything about that car that you need to know. You go across the street to the hospital and say, when's the last time I got a tetanus shot? Or what medicines were I taking, or was I taking? I don't know. And it seems to me that we need to be using technology to improve access, lower costs, and provide better health care. And that's what our speaker is going to be talking about today.
The current system is just wrought with waste, fraud, abuse, and friction. There's no single connection, no single place that you can go to get your own medical records. We firmly believe the consumer needs to be in control of that record and has the ability to then decide who gets to see it, when, why, and for what purpose. There's some technology issues that need to be taken care of there. Certainly among those are a national patient identifier that is a huge hurdle in order to fix this system and make sure that the right information does get to the right place. We do believe, however, that with recent investments in health information technology, we are at a unique crossroads and have the ability to connect these disparate systems and ensure that that information is delivered to the right place at the right time. And we refer to this as the facilitated network. This is the ideal of the health information exchange with all the additional services, pushing information into the right place, and not only for the consumer, but also for the provider. The average provider would be required to read 19 journal articles a day to stay up on the latest and greatest in medical technology or in medical practice. That's simply not going to happen. A single provider also has about 15 minutes to truly treat a patient. It's very difficult to push that information out to them, so we need to work with the provider community, and we believe that this needs to be provider-driven to make sure that it is part of their workflow, it gets used, and it is then connected to the system, and not just an expensive piece of equipment that sits on the sideline.
As you think about health information technology and bringing all of the folks together so that when a consumer goes into his or her physician office, we don't have to answer the same 20 questions we did just down the street last week. That we begin to share information and we have the best possible information for the provider at the point of care when the patient presents with whatever condition. And so you can see there are a lot of players in the healthcare space, everything from our physician practices, the free clinics, our FQHCs, our critical access hospitals, even our business and government play a role as the payers for that. So let's kind of roll the tape forward, if you will, and think about what it looks like in the year 2020. Our baby boomers are already straining the system. The digital generation is sitting in the seats that you all are sitting in today. We have global health care. It's like an ATM system. Imagine what that would be like if you could access your health care information like you access your banking information. When I was in Kuwait serving on behalf of the United States Navy, I was able to draw money out of my checking account here, but they could not access my medical records. The Center for Health Care, as we know it today, has moved from the acute care setting into the home, the work, and the office. Cell phones like this will have become medical devices. And there will be an increase in genetically personalized medicine as we understand more about what you are genetically predisposed to. We can get in front of those diseases and prevent as opposed to spend time trying to cure.
Governor Nixon did sign an executive order, and I think you all have a copy of that, creating the Missouri Office of Health Information Technology, which is really given the responsibility to begin to coordinate and help develop the application of health information technology and health information exchange infrastructure for the state. Not to manage it, not to operate it, not to own it, and I'll come back to that, but to facilitate, and that's what we're doing right now. I sort of see where we are as still having a rotary phone in healthcare information technology. I think there's a guy, Steve Jobs, who helped create the iPhone. You're talking about different worlds, different centuries, and that's where we need to go in healthcare information technology. In the 50s, we had two-lane highways, and I think it was President Eisenhower that really initiated the concept of the National Highway System. And what we're really doing, and what high-tech dollars and the ARA dollars and goals are intending to do, is to create a new information highway for healthcare and set that vehicle in place.